Hello everyone, just want to share some information I just learned not too long ago, and I thought it would be important for everyone to understand the implications and the importance. This is John Lin from Sunrise Urology. I am going to share with you some changes that are occurring from Medicare. Medicare card is changing. That means our patients are going to be presenting with new Medicare cards with new Medicare numbers. For our practices, we will have to be prepared to take these new cards and use it and input it into our electronic health records and be able to submit claims. So that means your infrastructure will have to change. In addition, you will have to train your staff to understand and know how to capture this new information and then integrate it into your practice management system. I will put in the video description below the link to CMS's website regarding the new Medicare benefits card. In the past, the Medicare card comprises of the beneficiary's social security number plus an alphabetical suffix indicating Part A or Part B benefits. And the new card is going to be 11 characters. It'll be alphanumeric. And starting April 1st of 2018, the cards will become available, which means our practices will have to be ready to use and accept these cards. Now, the government has designated a transition period from April 1st of 2018 until December 31st of 2019. Starting in January of 2020, only the Medicare benefits identifier, the new Medicare number, will be used when you submit claims to Medicare for payment. And this has huge implications, especially when we are doing value-based purchasing, reporting, and Medicare is looking at our practices data and our performance, if you will, using various beneficiaries' numbers, especially when we have the old number and now mixed with the new MBI, the new Medicare beneficiary identifier. It's going to be very confusing. As you all probably know, part of MACRA, or Medicare Access and Chip Reauthorization Act, that was passed in 2015, part of that evaluates a provider's cost to the Medicare system. And I wonder how that is going to be attributed accurately to the providers. That's just one of many questions that I have regarding implementation of the new number. And by the way, the new Medicare MBI is implemented as part of MACRA. MACRA mandates that CMS has to change the Medicare beneficiary identification number from the traditional Social Security number to the new format. The other issues are what happens to your prior claims that you submitted using the Social Security number. What about appeals, adjustments, reporting, which I touched upon, and what about when you query a beneficiary's claim status and checks? How is that going to be happening? So a lot of changes, even though if you think about it, from April 1st of 2018 to December 31st of 2019, you're thinking that's over a year and a half. But keep in mind, you're going to have to educate your staff. You have to implement changes to your electronic health records and practice management software and make sure everything jives. All the while you have claims that are outstanding that you may be appealing. In addition, you will have patients, Medicare patients, who are going to be coming in to see you, and they're going to be confused about the new MBI versus the old Medicare number. When do they get their MBI? When do they get their new Medicare cards? And by the way, CMS is not telling us when the cards are going to be mailed to the CMS beneficiaries, and that's to protect. It's to safeguard these cards and these numbers. So your patients are going to be confused, and it'll be up to you to educate your staff to make sure they are not confused. I hope this has been helpful. Check in the video description below, and if you like what you see, consider hitting the subscribe button. Take care.